CDC sounds alarm about low vaccination rate amid rising respiratory virus activity. Fewer than 2 in 5 adults have gotten their flu vaccine this season, and only about 1 in 6 have gotten the latest COVID-19 vaccine, according to CDC data. CNN, the U.S. Centers for Disease Control and Prevention says there is an urgent need to boost the vaccination coverage amid increasing levels of respiratory disease. Low vaccination rate, coupled with the ongoing increases in national and international respiratory disease activity caused by multiple pathogens, including influenza viruses, SARS-CoV-2, the virus that caused COVID-19, and RSV, could lead to more severe disease and increased healthcare capacity strain in the coming weeks. The agency wrote in the Health Alert Network advisory Thursday. In addition, a recent increase in cases of multi-system inflammatory syndrome in children (MISC) following SARS-CoV-2 infection in the United States has been reported. About 7 million fewer adults have gotten their flu shot so far this season compared with the late last virus season. Overall, uptake is about 36% for both adults and children, according to CDC data through November 18. Vaccination coverage for COVID-19 is also low, with just 17% of the adults and about 8% of children getting the latest shot, according to CDC data through December 2nd. That includes about 36% of seniors who are at higher risk of severe disease. Also, another only about 16% of older adult ages 60 and up gotten the new RSV vaccine. Key reasons for low vaccination rates include the lack of a provider recommendation, concerns about side effects, and the lack of time or forgetting to get vaccinated, according to findings from the nationally representative survey of U.S. adults that are shared in the CDC advisory. We are seeing too few folks to get vaccinated this season, CDC Director Dr. Mandy Cohen said at the briefing with the American Medical Association on Tuesday. The voice of the physician matters so much in whether or not folks decide to get vaccinated. The CDC recommends the flu and COVID-19 vaccines for everyone ages 6 months and older, and the new RSV vaccine is available for adults 60 and up. Immunization helps to prevent hospitalization and death from respiratory disease, and it is especially important for those at increased risk for severe disease, including infant, older adult, pregnant people, and those with certain underlying medical conditions. About 70 to 80% of American adults over the age of 18 have at least one condition that puts them at higher risk of the bad outcome, Cohen said. Getting vaccinated decreases your risk of hospitalization and death at every age, including 18 to 64, but it also decreases your risk of long COVID. About 1 in 7 adults who have had COVID-19 report long COVID symptoms, including ongoing fatigue or cough, which can develop even after a mild illness, she said. Children are less likely to have severe outcomes, but emergency department visits and hospitalizations for respiratory disease are rising across age groups, CDC data shows. In the past 4 weeks, hospitalizations increased 200% for flu, 51% for COVID-19, and 60% for RSV, according to the advisory. There have been 12 reported pediatric influenza deaths and 30 reports of MISC, a rare complication that typically happens a month after a COVID-19 infection. Respiratory disease activity in the US is highest in the south, but quickly rising in northern states. The CDC recommends that people talk with their health care providers about the vaccines that are recommended for them and their families. Locations offering the seasonal vaccines can be found on vaccines.gov, and the uninsured adults can receive the COVID-19 vaccines at no cost through the CDC's Bridge Access program. Everyday prevention measures such as covering cough and sneeze, washing hands, and staying home when sick can also help reduce the spread of illness. These tools that protect us vaccines, testing and treatment, and washing hands, and ventilation and mask all of these things are layers of protection that help make sure that we can weather we can weather this season, Cohen said.